Hi, welcome to this TePe webinar. I am Michaela von Geijer, a dentist working here at TePe headquarters in Malmö, Sweden. We think that knowledge and insight sharing is important, and we hope that you, after watching this video, feel inspired to work towards good oral health together with us. In this part of Pharmacist Guide, I will introduce you to the topic of bleeding, swollen and inflamed gums. How do you prevent and reverse gum inflammation? Here are some tips and advice. Did you know that more than 1 out of 10 suffers from severe gum disease? This is when quite a lot of the bone that supports the teeth is broken down and some teeth may move from the original position. Research tells us that most people are not even aware that they have gum disease. Most often there is no pain or discomfort until the very late stages. A healthy smile is important for your self-esteem, your confidence to smile and your ability to chew and speak properly. Research shows that gum disease affects your overall health. Gum disease is linked to several systemic diseases, for example diabetes and cardiovascular diseases. Early signs of gum inflammation is bleeding when brushing or cleaning between the teeth, or blood in the sink after you brush your teeth. Bleeding is never normal. Bleeding gums, redness and swelling are all signs of inflammation due to build-up of bacterial plaque on the teeth, especially along the gum line, as you can see on the picture. If the bacterial plaque is not brushed away, it grows in the space between the tooth and the surrounding tissue. The plaque hardens into tartar on the root surface, which causes the supporting bone to break down. The tooth loses more and more of its attachment. Now the gum inflammation has developed into periodontitis. However, you can prevent gum inflammation and periodontitis through good oral hygiene. So what's the advice for someone who tells you that my gums bleeds when I brush? I would suggest brush thoroughly twice a day for 2 minutes and clean once a day between the teeth, preferable in the evening. Some tips for toothbrushing. Hold the brush at an angle of 45 degrees against the gum line, where teeth and gums meet. You should feel the toothbrush bristles. Make sure that you clean all teeth and all surfaces. Brush with small movements and light pressure. Toothbrushing, whether manual or electrical, is not enough. The tooth has 5 surfaces. With a toothbrush, you will only reach 3 of them, that is 60% of the surfaces. You won't access the important surfaces between the teeth where gum disease, periodontitis most often starts. Cleaning between the teeth should be included in the daily oral care of every adult. It is just as important as using a toothbrush. According to studies and best practice, interdental brushes are most efficient in removing dental plaque between the teeth and reducing bleeding gums. An interdental brush is ideal for people with bleeding gums or bigger spaces between the teeth. When gums become healthier and less swollen, you will need a bigger interdental brush. Therefore, I recommend beginners to get a mix pack for sizing, because it is difficult to know which sizes you will need when the gums are less swollen. TePe offers 9 color-coded sizes to fit narrow and wider spaces. All brushes have a plastic-coated wire for maximum safety and comfort. The brushes are suitable for all users. Here are some tips for trying out the correct size. The brush needs some resistance to clean the space efficiently, as I'm showing now, but never force the brush in between. The plastic-coated wire shouldn't rub the tooth. If unsure about the size, rather use a smaller size and lean easily towards one tooth surface and then the other. For better access when cleaning further back, bend the wire, or if you use one of the 4 smaller sizes, bend the neck. The cap can be used to extend the handle. The interdental brush should be used with water. After use, rinse under water and let dry. When it's time to change, take a look at the filaments. When they clump together, it is time to change. It can happen after a week or longer, depending on the size of the brush, how much it is used, and if there are fillings or crowns in the mouth. The brushes are also available with extra soft filaments, suitable for patients with dry mouth, sensitive teeth, or sore gums, or simply for those who prefer softer brush. Some prefer this long and flat handle. The angled brush head can make it easier to access the back teeth or to clean teeth from the inside. A complementary product for all patients with spaces is the EasyPick, a modern toothpick. It is easy and efficient to use during the day, for instance after a meal. EasyPick comes in different sizes. A handy pocket case is included in some packages. For proper cleaning in the evening, I would recommend an interdental brush. Some patients need a special toothbrush for cleaning hard-to-reach areas. Compact tuft has a dense, rounded tuft, ideal when cleaning, for example, along the gum line or for proper brushing of the last tooth. Another choice for cleaning the last tooth or a furcation is the interspace. Sometimes an antibacterial agent is needed. The locally applied chlorhexidine gel can be a complement to mechanical cleaning for a limited time. It is convenient to apply with an interdental brush. TePe's gingival gel contains both chlorhexidine and fluoride, free from colorants, alcohol and abrasives. For people with bleeding gums, it is recommended to continue brushing and cleaning between teeth even if gums are sore or bleed. If there's no improvement after a week, consult a dental professional. Gum inflammation might be hard to detect, and not everyone will discover bleeding when brushing. Therefore, it is important to have regular health checkups at a dental office and to maintain a good daily routine of cleaning all surfaces of the teeth. Gum disease requires lifelong attention and professional care. Keeping your own teeth is always the best. Thank you for listening to my introduction to bleeding, swollen and inflamed gums. For further information, please download the Pharmacist Guide. I invite you to continue browsing our other videos and materials on oral health and keep sharing.